right. Well, I will go ahead and get started. Thanks, Annie. I'm going to go ahead and share my screen, but my name's Dr. Majdee Islam. I'm a urologist over at Urology of St. Louis. I specialize in men's health, and so I do a lot of things that include erectile dysfunction, um, sexual dysfunction in general, as well as fertility and infertility. And today I'll be talking to you guys about erectile dysfunction as well as male incontinence. And I am going to go ahead and share my screen. Let me know if you guys have any issues with seeing that. Otherwise, go ahead and get moving. Um, yep, as you can see, that's me. My name's Majdee Islam. Long story short, went to med school here at Mizzou in town, undergrad and med school. And I went to Colorado, did my residency. I did my fellowship at UCLA. Stayed out there for a bit and then moved back into town. And then my offices are over there on the right. I'm in here in Town and Country, as well as on the Illinois side in Alton and Fairview Heights. So we'll get right into it. We'll talk about erectile dysfunctions and options. So, one of the things I like to kind of start off with is erectile dysfunction, kind of what is it, what causes it, and how often it happens. And so the big thing with erectile dysfunction that I like to tell guys, it's much more prevalent than most men think it is. And so, about 20% or 1 in 5 men that are older than 20 are going to have some aspect of erectile dysfunction. And over half of guys over 40 have some aspect of erectile dysfunction. Now, erectile dysfunction, the most important thing about it, in my opinion, is that it's not just the inability to get an erection, period. It's the inability to get an erection that's rigid enough for penetration, or I even like to tell guys it's the inability to get an erection that's rigid enough for your satisfaction, for whatever that may be. And so erectile dysfunction, again, isn't necessarily that you're not able to get an erection. It's that you don't have an erection that's to your satisfaction. I think that's important. And so kind of how it works, you can see in these pictures over here, whenever you have stimulation, there's nerves that surround the penis that become active. Those nerves that stimulate blood vessels that then dilate. It relaxes the muscle around those blood vessels, and then they dilate, you get blood flow, and you get an erection. And so what causes erectile dysfunction? This is an interesting thing, a little kind of slide here that talks about the biggest causes. You can see there it says vascular, diabetes, and medication. So, things like high blood pressure, high cholesterol, vascular issues, along with diabetes, high sugars. Those account for about 70% of erectile dysfunction. Now, there's other things that are that can be related to medication, that can be related to, a big one is prostate cancer. So as urologists, we see a lot of that. There's a lot of guys post prostatectomy or post radiation will have erectile dysfunction, but those are basically a lot of the potential causes that cause guys to have erectile dysfunction. Now, a huge part of erectile dysfunction is quality of life. And I think this is super important, and we won't spend too much time on this, but it's not just the fact that you have an issue with an erection that gets in the way of your own, it gets in your own head, but the important thing is that it also affects socially how you're doing. So a lot of guys get a lot of psychological issues, get depressed, have issues with depression, affects mental health, it affects relationships, it affects overall a guy's entire being because of the fact that it affects things like your social life, your relationships, etc. So there's a lot of studies actually looking at erectile dysfunction and the psychological effect, but also erectile dysfunction and quality of life. And there's a significant decrease in quality of life in guys that have erectile function. And so it's not just a medical issue, but also it can be a significant quality of life / psychological issue as well. So we'll get into a little bit of detail about erectile dysfunction and the potential causes. Diabetes is a big one. And so, about half of men with diabetes have some aspect of sexual dysfunction. And the other important thing is erectile dysfunction medication, stuff like Cialis, Viagra, is not as effective in guys that have diabetes. And so it's really important to note that you have guys with diabetes are more likely to have erectile dysfunction. They're not going to have treatments that respond as well. And usually the erectile dysfunction is more severe. The other thing, and we'll talk about this in a second, for multiple of the medical issues, but with erectile dysfunction, it's usually a symptom, but not a diagnosis, meaning it's usually a symptom that comes from something else that's going on, like we talked about earlier, the vascular issues, the diabetes, etc. So I always tell guys, if you have erectile dysfunction and you haven't been to a doctor in a while, make sure that you're not just going to see your urologist from an erectile dysfunction standpoint, but also go see your primary care physician or see your urologist, and we'll help you out to try and figure out what's causing erectile dysfunction. Is it high blood pressure? Is it cholesterol? Is it diabetes? Is there something else that's potentially causing it? That's really important, a really important part of being a urologist that I like to talk to patients about when they come in for erectile dysfunction. Um, so from a diabetes standpoint, it kind of hits in from two different angles. That's the issue with diabetes. It not only affects the nerves that stimulate the penis to get an erection, but it also damages what's called the endothelium or the blood vessels. So the issue with diabetes is the reason it's so severe is because it's not only affecting blood flow, it's also affecting the nerves that help to improve or increase blood flow. And so, with diabetes, kind of like we talked about before, but the older the diabetic is, the worse the sugar control is, and potentially if they have concomitant things like high blood pressure, high cholesterol, like it says, cardiovascular issues, that can increase the potential severity of erectile dysfunction in those guys. And so, there's studies, quite a few studies that actually show that combination of diabetes and heart disease can significantly increase erectile dysfunction, which is again another reason why any guy that comes in that just has erectile dysfunction, I strongly encourage, or I actually will send them oftentimes to a primary care physician to make sure they get worked up, or at least start the workup in my office to ensure that we're not missing some kind of heart disease or some kind of diabetes. So heart disease, kind of rolling along. I won't delve too much into this because we talked a lot about this, but kind of the same deal. Erectile dysfunction and heart disease, there's a significant connection with guys that have erectile dysfunction and the risk of having some kind of cardiac event within 3 to 5 years. And this is huge. So a guy will usually get erectile dysfunction and potentially already have some heart issues that are going on that just aren't symptomatic or haven't come up yet or come to your attention. Again, why it's so important to make sure that that guys are getting checked out or seeing a doctor or a primary care physician. And the reason this is important is because, or I'm sorry, the reason this happens, the penile artery is significantly smaller than the arteries that supply the heart, as well as the arteries that are in the legs in general. The long and short of it is the penile artery being smaller is going to be affected more quickly than the bigger arteries. So if you're starting to get something that's affecting the penile artery, it's eventually going to affect the other arteries that are much bigger, but very, very important. Meaning, if you have heart issues, meaning if you have something that's clogging the heart artery, that's a precursor to potentially have something like a heart attack or a stroke for the carotid artery. So again, super, super important that erectile dysfunction can be a precursor to other symptoms of heart disease. Now, anything ever doctors ever told you or anything you've ever heard of, the big things that you can do to improve not only your erectile dysfunction, but also your potential overall heart health. Healthy diet, low salt, low sugar, low fat diets, exercise. So at least 3 times a week, trying to do some kind of physical activity of at least 30 minutes that raises your heart rate. Weight loss, don't smoke, reduce stress. Those are 3 things that are really important, but they're really difficult to do. So it's easy for me to say, but super, super important to try and take care of as you can. So this is an interesting kind of topic, low testosterone and erectile dysfunction. So I always tell patients low testosterone and erectile dysfunction kind of go hand in hand. Testosterone is something that's pretty variable. So men can have different testosterones and it affects men in different ways. However, if a man does have low testosterone, it can significantly affect their erectile dysfunction. And so, I'm sorry, their erectile function. And so about 40% of guys that are over 45 can potentially have a low testosterone. That's something I do pretty regularly in my clinic, is when a guy comes in with erectile dysfunction that's not having great effect, and there's not much else that we can figure out that's causing it, we'll check a testosterone and make sure that we're not missing something. And so testosterone not only affects sexual function, it also does affect things like energy, having things like fatigue. You can have this concentration, this brain fog in general. So it affects not just erectile dysfunction, but it's a piece of the puzzle. So testosterone is a big part of it, and it kind of talks about that those other symptoms here. Testosterone can be a part of the story, but there's other things that the testosterone can affect as well. So if you feel like you're having symptoms of sexual dysfunction, but also you're a little tired, or you're not getting through the day as rigorously or as well as you used to, testosterone can be something to ensure to check. And I'm not going to talk too much about this, but there's different options for testosterone, like injections, like pills, gels. And so if it's something that you're interested in getting checked, it's a quick blood test to check your testosterone, and then there's definitely options to treat it. Prostate cancer. So the nerves that affect the erections kind of run right around the prostate. And so whenever you have prostate cancer treatment, whether that's radiation or surgery, those nerves can take a bit of a hit. And so whenever the nerves take a bit of a hit, it can affect erectile function. I usually tell guys there's a 50-50 shot that you're going to have your erectile function take a hit after any kind of prostate treatment. And so there's some guys where it affects it more significantly than others. Some men have no effect. Some men are significantly affected to where they are not able to have an erection that's rigid enough for intercourse, despite oral medications, injections, other aggressive treatment options, which we'll talk about here in a second. And so, again, it's not an uncommon thing, regardless of how successful the treatment was. It's important to note that it can still continue to affect your erectile dysfunction even years after you've had radiation or years after you've had surgery. Peyronie's disease. So I do quite a bit of this as well. So Peyronie's disease, and when you have penile curvature, again, I won't delve too much into this, but basically the penile curvature comes from some kind of trauma to the penis. And so that trauma causes a little plaque or scar tissue that forms. So then when you get an erection, the penis curves. The issues with Peyronie's disease is you have curvature. It can cause issues with beginning an erection. It can cause issues with discomfort with erections and cause issues with being able to have penetrative intercourse because of the curvature, along with potential pain to the partner. And so erectile dysfunction can be a part of Peyronie's disease, meaning when you have that curvature with that plaque doesn't allow for an appropriate amount of blood flow to the penis, and so you can get erectile dysfunction as well. So oftentimes we'll treat guys with Peyronie's disease along with erectile dysfunction kind of at the same time. I do a lot of this thing called Xiaflex, which you guys might have seen a commercial for. Basically, it's the bent carrot commercial. It's an injection that tries to dissolve the plaque, and it works extremely well. There are situations when a guy doesn't have good erectile function, or they have zero erectile function and also have penile curvature. Oftentimes, we can treat those guys either with Xiaflex and then with something called a penile implant, or you can potentially go straight to a penile implant if you have erectile function that's severe enough, along with Peyronie's disease. So Peyronie's disease is a big part potentially that goes along with erectile dysfunction that can be treated at the same time. So treatment options for erectile dysfunction. So this is kind of the meat of the talk here. A big important thing here, you don't necessarily have to see a urologist right off the bat. There are guys like me, doctors like me, I should say, who treat erectile dysfunction and specialize in it. And so it's very, very appropriate. And I have a lot of primary care physicians that refer me their patients that have erectile dysfunction and haven't started them on anything, which is totally appropriate. You can also just go to your normal general practice doctor to talk to them about erectile dysfunction and see what your options are, because oral medication is a very easy thing to take and it's pretty straightforward to prescribe. Urologist in general is an important person that you can talk to. There's also what's called prosthetic urologists, people like me who treat ED and do it day in, day out. It's the bulk of my practice. And so it's important to know that you can go to kind of any of the above. So treatment options, we'll talk about all of these in a little bit of detail. So oral medications, most of you guys, I'm sure, have heard of things like Cialis and Viagra. So those are going to be the medications that basically can increase blood flow by relaxing that smooth muscle around the blood vessels to get an erection. So you take the medication usually about an hour or so before activity. Cialis is usually in your system for about 36 hours, whereas Viagra is in the system for about 4 to 6 hours or so. You can either take the medication daily, or usually most guys will take it as needed. They're effective in certain men. They're very effective, and certain men they aren't. And so that's usually the first step that we'll take, and they can be effective to a certain point. However, the important thing, a big thing to note with the oral medications, as effective as they are, some men will have side effects that can be pretty severe with the medication, things like headaches, congestion, acid reflux, and vision changes. And so there are some men that do have significant improvements. However, they can have some side effects. And so with the medications, the big thing that you want to make sure of is if you have any kind of heart history, making sure that you talk to your cardiologist about potentially taking the oral medication, as well as making sure that you're not on any nitrate medications. So the one contraindication with the oral medications like Cialis and Viagra is if you're on a nitrate medication. And if you're on one, usually your doctor will tell you, but there's certain ones that help with blood pressure, but most commonly it's one that helps with chest pain. Vacuum erection device. So this is basically a glorified penile pump. You put a cylinder on the penis, you start this pump, it brings in blood flow, and you put a little band at the base of the penis. Patient satisfaction isn't great with it. It improves the erection. It's not always the most effective, but it can help be a tool to improve the erection for a lot of guys that either just want to use the device by itself versus using it in congruence or in combination with the oral medications. I have plenty of guys that use it and are happy with it along with Cialis and Viagra. To be totally frank, most of my guys that use the vacuum erection device will use it for some time and then move on to something more aggressive because of how cumbersome the device is. It's cumbersome, it's uncomfortable, you can have some bruising, and oftentimes because of the band, it can sometimes cut off a little circulation, so you can get this numbness and coolness. And so again, most guys don't love the idea of the vacuum erection device over time because it doesn't work as well, or it's just kind of cumbersome. The urethral suppository. So basically, this is a little pill that you push into the P channel, to the urethra. It takes about 5 to 10 minutes. It brings in blood flow to the penis directly from the medication being absorbed to the urethra. I, to be totally honest, it's been years since I've prescribed this to a patient, mainly because it doesn't work as well as the injections usually, and it's a little bit more uncomfortable than the injections, and it can cause pain in the urethra. So I'm gonna spend no more time on this because I actually don't prescribe it because it doesn't work as well as the injections, and it's more painful and has more side effects. So I actually am not a huge fan of the suppository, but it's an option. This is the injection. So the injection basically is when you take something called it's called Trimix, we actually call it. It's alprostadil plus a couple other medications. That's the one I use. You inject the side of the penis with a tiny needle, and most guys feel like a pinch, and that's about it. Directly injected in the side of the penis, wait about 5 to 10 minutes, and then actually, there's some studies that show that about 70 to 80% of men can find a dose that's rigid enough for penetration. The caveat, of course, is it's a needle to the side of the penis every time that you want to have intercourse, and so some guys get a little bit of discomfort. There is a risk of what's called a priapism, so an erection that lasts too long. But most importantly, it's an injection every time you want to have an erection. It works great. I have guys that have been on the injections for years and years and love it and have no issues with it. And if that and a lot of guys swear by it and have no issues with doing it for the rest of their lives. Usually, the only reason that a guy stops doing the injections or moves on from it is because if it doesn't work, A, or over time they just get tired of doing the injections every time they want to have intercourse. The penile implant. So we'll talk about this in a little bit more detail, but basically the penile implant is a surgery where I place this implant, this prosthesis into the penis, basically into the scrotum. So we'll go through the details in a second. Extremely effective. 96 to 98% of patients are satisfied and are super happy with the results. Most of the time, it stays in basically for the rest of your life, essentially. Side effects, it's a surgery, so there's risk of pain, risk of bleeding, risk of infection, things of that nature. There's a risk that it stops working at some point. Biggest risk is infections. I always tell guys, if you're a diabetic, if you've had radiation, that increases your risk of infection. But because it's a foreign body going into the penis, there's a risk of infection along with it. It's a great device and it works extremely well. And I'll talk to you a little bit more about it, basically about how it works. I think I can get this to play and have you guys take a look. So we'll skip ahead a little bit. But that's the implant. You can kind of see that's it inside the penis. There's a pump that's in the scrotum that you pump that brings in fluid from the reservoir that's up behind the bladder that brings in fluid to the cylinders and gives you an erection. You use the erection as long as you want. Once you're done, there's a little button that you just press, hold for 3 seconds, and it takes all the fluid back into that reservoir and it gets rid of the erection. And it's as simple as that. I tell guys it's like a third testicle that sits there, and you basically use it in order to inflate and deflate the implant. The benefits of the implant, the great thing about it is it looks just like a normal erection. So nobody, if you were just looking at the erection or you're looking at a flaccid penis, you would have no idea that there's not an implant that's in place. Spontaneity, and so you can pump the implant up whenever you want to, have an erection that's rigid enough for penetration, and then get rid of it as soon as you're done. Most importantly, it doesn't cause any issues with sensation, meaning the penile sensation stays intact. Orgasm sensation stays intact. If you are able to ejaculate prior to the procedure, it won't affect ejaculation afterwards. So that's not a problem at all. And they've been around for a long time. And every few years, we've had improvements. And so, there's the ones that we have right now are the most updated ones that we've had in a long time, and they're fantastic. I did an implant this morning. I do quite a bit of the surgery, and it's very uncommon that I have a patient that's not satisfied or not happy with it because you went from needing to do injections or not having a rigid erection for years to be able to get an erection and have intercourse with a partner or self-stimulation or masturbation literally whenever you want. Now, it's a surgery. And so the most important part about it is with a surgery, there's a recovery period. You're recovering for, about, 3 to 4 weeks afterwards. You have some soreness that's down there for some time. There's bruising, there's swelling. Most importantly, there's that risk of infection, the risk of the malpositioning, the malfunction, etc. With those risks being as low as they are, though, most guys, once they get past that recovery period, start using the device and are extremely happy. Insurance, big important question a lot of guys will ask, does insurance cover it? It's not guaranteed that it's going to cover it. I have only had one guy so far, knock on wood, that I've had issues with getting coverage for. Usually, most insurances will cover the implant, including Medicare, which is great. Again, so the risks we talked about, the main risks, the most important risks are the fact that it can fail, so make the malfunction of the device, infection, huge important part, and then of course, pain after the procedure, usually with the healing process. The other kind of risk that I tell guys is, there's a chance that for whatever reason the device, it so I always tell guys, I always par your expectations. The most important thing is it's not going to be the erection that you had when you were 20. It's going to be a fantastic erection that's rigid enough for penetration. But especially for some guys, over time, the penis does have a little bit of shortening. So I place a custom fit implant into your body that's going to give you a fantastic erection. I always tell guys, though, it's not going to be that, that 8-inch penis that you remember when you were 20. And the unfortunate thing is I can't make it any bigger than it is right now, other than what your body will give me. So a lot of guys come in hoping that's going to be the case. Unfortunately, that's not. But after we, make sure that guys aren't expecting something super, 7 inches bigger than it was before, most guys are very, very pleased with the results. So, from an erectile function standpoint, it's very, very common, like we talked about. The important thing, though, is there's quite a few treatment options. Penile implants is a great option, but most importantly, make sure that if you have erectile dysfunction, you haven't talked to a urologist or a doctor in general about it, to ensure that you go in to talk about it, not only to talk about your erectile function, but also make sure that you talk about potentially the causes and get a workup and make sure that you're not having any issues from a cardiac, diabetes, vascular standpoint in general. Quickly, I'm going to run through stress incontinence. I'm going to just do a little overview of the stress incontinence. We're going to shift gears for a second. So with male incontinence, it's bladder leakage. So male stress urinary incontinence is whenever you're having leakage when the sphincter muscle isn't working as well or it's weakened, and you're not able to control your urine flow. So usually it's stress activities, laughing, coughing, sneezing, things of that nature that cause you to have leakage. Most commonly, it occurs after prostate cancer surgery. It doesn't necessarily have to be prostate cancer surgery, but about 50% of guys will have some aspect of leakage. Usually they heal, but a lot of guys after a year, about 10% of guys will continue to have leakage after prostatectomy, after surgery. And so, the process, essentially, the bladder keeps the urine there. There's a sphincter that you see on this picture that keeps the urethra nice and tight to keep the urine in the bladder. The issue is that sphincter muscle becomes damaged, whether it's with radiation versus with the prostate surgery. And so then, because that sphincter ends up being damaged, it's not pinching that urethra together and not able to keep your urine where it should stay, essentially. The most common reason that we see urinary incontinence usually was with prostate cancer surgery. There can be neurologic issues that cause it. There can also be, obviously, other types of trauma that can cause it. Also, pelvic radiation, whether it's for prostate cancer or something else, can cause it as well. And so, again, urinary incontinence, as you would imagine, it can really affect quality of life. Guys that are walking around, unfortunately, cough, laugh, sneeze, and they wet their underwear out, walking around, playing sports, etc., just walking. And so it can really affect their mental health pretty significantly. A lot of guys are, having to wear diapers, things of that nature, pads. And so it can be something where when it's treated could really improve a guy's quality of life. We talked about the association with prostate cancer and the potential effect that it has. We'll jump over to treatment options. Again, urologist and prostatic urologist, I actually don't do the surgery for male urinary incontinence. One of my partners actually does. So he and I do a lot of the implants. He does some implants as well, but he does a lot of two of my partners actually do a lot of the slings, and what's called the artificial urinary sphincter. Treatment options for continence, behavioral modifications, doing things like, planning, going to the bathroom, fluid intake restrictions, etc. There's something called pelvic floor physical therapy that can help, Kegel exercises, using things like pads, penile clamps, etc., that can potentially help. A lot of these are expensive and they aren't as super effective, or they don't really help with quality of life. And so the long-term options, the two of them are a sling and an artificial urinary sphincter. So the sling basically is this minimally invasive procedure that is done, usually within about half hour to 45 minutes. There's no device. Basically, it's a sling that's placed underneath the urethra that essentially acts as a sphincter, if you will. That acts as a sphincter, if you will. And the benefit is it's quick to do. There's not a whole lot of contraindications to it, and it provides guys that have a lower amount of incontinence some pretty good success. The artificial urinary sphincter essentially is a sphincter, literally an artificial sphincter that's placed around the urethra. This is usually for guys that are having pretty significant amounts of leakage. And so if they're having leakage that's requiring more than a pad or so a day, oftentimes that sphincter is going to be your best bet as opposed to that sling. So this is a little animation. So you can see basically around the urethra, that sphincter is sitting and kind of squeezing. You've got this pump that's in the scrotum. You press that pump and it allows that sphincter to open. When it opens, it allows men to drain the bladder. After about 30 seconds or so, the sphincter will automatically close and then you're able to hold your urine. So the important thing is all it takes is a quick squeeze, you empty the bladder, and then it automatically squeezes again. And so then it's able to keep the urine from being incontinent again. There's a website called fixincontinence.com that is excellent, that has a ton of information about incontinence to find out the treatment options, to find somebody in your area that does urinary incontinence treatment. And so I think it's a great website for incontinence. For erectile dysfunction, there's one called edcure.org, which is fantastic as well. Now, I'm not going to delve into the risks, the treatment, because from a treatment standpoint, the sling and the urinary sphincter, I actually don't perform those procedures, but my partners do. Today's talk is mostly going to be focused around erectile dysfunction, but in a nutshell, the sling, it can fail. Occasionally, it doesn't work. You can have potential urinary retention with it, meaning the sling was tightened too tight. That doesn't happen very often, or potentially you can have irritation where it's placed. The urinary sphincter, it's a little bit more of an invasive procedure. So similar to the implant, the device can malfunction. It can erode into the urethra, which means it can the actual sphincter itself can go into the urethra, requiring removal and replacement. And it can also be a little too tight. It can cause urinary retention. Again, doesn't happen too often, but it can happen. And same deal, insurance, usually it's covered, which is a fantastic thing about these devices. Insurance, most of the time, including Medicare, will normally cover the devices. Okay, so I'm going to stop sharing my screen, and I'm actually going to turn it over to Cliff. So Cliff Pollock, he's one of our, I think Cliff's over here. Yeah, I see him there. Cliff will tell you about his experience actually with a penile implant. He's a wonderful resource that we've got. He's a patient that has gone through it. And so I'll turn it over to Cliff to let him kind of talk about things, and then Cliff and I will finish up and take some questions.
Thanks, Dr. Islam. Good evening, everyone. My story is very simple. When I was 58 years old, I developed prostate cancer. And even though it was only showed one little spot in the prostate, my wife and I talked about it and decided the best thing to do was to remove the prostate. Unfortunately, my urologist never told me about what the after effects could be. And of course, one of them was ED. So I went back to my regular doctor and they put me on Viagra. Unfortunately, the Viagra gave me such headaches that I couldn't pick my head up off the pillow. I had to lay down and stay in bed. So they switched me to Cialis and Levitra, and it was the same problem. So after about 8 months of those three medications, we tried the external vacuum device. Now that worked fine, except it's not spontaneous. And when you use it and you pump up and you put this band on, which is really a tourniquet, your penis becomes cold, it becomes blue. It doesn't look very natural or appetizing to your partner. And after a while, you get to the point where removing the band up the shaft is not a problem, but when I took it over the head of the penis, it really hurt. So I did away with the external vacuum device. Then for 2 years, I actually knew nothing about anything else as far as what we could do to stop the ED. Back then, I got a call and a letter inviting me to a seminar about ED, and I learned about the little pellets, the mousse, the injections, and the implant. I wasn't too thrilled about the injections, and the mousse didn't sound good because the injections and the mousse, when you go traveling, you have to keep cold, refrigerated, and all that. And we did a lot of traveling around the world. So we decided the best thing to do was to have the implant done. So at age 61, I had the first implant done. I say the first because 14 years later, I had it replaced. But the first implant was done when I was 61. And what it did is it gave me back my manhood. It gave me back the intimacy that I had lost with my partner. Uh, I think it's very important that you understand too that ED is not just a male issue, it's a partner's issue. And my suggestion right off the bat is that you get your partner involved with speaking with the prosthetic urologist when you want to get some help with ED so that they are on board and understand what's going on. Because I hear a lot of men tell me that their wives have said to them, oh, he must be having an affair. He doesn't love me anymore. All of this stuff, which is the farthest from the truth. So getting them involved with your doctor and with your care, I think is very important. My recovery was basically very easy. 2 weeks after my surgery, I went back to work. I did not take the medication that they gave me, which were, narcotics to take care of any pain, because I really didn't have more pain. I had discomfort, and the discomfort was taken care of by Advils. And I took the Advils, and after 3 weeks, swelling went down, back and blueness left. After 4 weeks, went back to the doc. He showed me how to use the prosthesis and told me to go home, pump it up a few times a day and get used to it. And I did. And the beginning of the 6th week, we started to have relations again. And at that point, we realized how much intimacy we had lost over the last 2 years. It really, really makes a major difference in your life. People ask me, well, okay, what do you do with it as far as, sports and stuff like that? When they told me I can have intercourse again, I went right back to the gym and started working out with the guys I work with. And I would take showers with them. They have absolutely no idea there's anything inside me. As far as my wife was concerned, had she not known me before the surgery, she has told many women you could not tell there was something inside that was not natural. It looks and feels to your partner as a natural erection. The only difference is when you use the implant and you you blow it up, you do gain a little girth at the base, and that's the only giveaway. So if you have lots of girlfriends that never saw you before, they would never know if you had an implant done. People ask me things such as, well, what happens when you go to the airport and you walk through the metal detector? The answer is nothing. Sometimes my knees go off because I have artificial knees, so they take you over to the corner, and you've probably had this wand. You've seen somebody be wanded, where they take this wand and run it over your body on the inside of your thighs and up around your crotch, and nothing happens at all. They have no idea there's anything there because there's hardly, I don't think, an ounce of metal in that thing. My implant lasted me, the first one, 14 years. And I was ecstatic. For all 14 years, it gave me a rock hard, solid erection that was good for any type of intercourse we wanted. One thing that is a little different between the time you were 18 and having an implant is when you're 18, your erection kind of goes out at a 45-degree angle from your body. With the implant, your erection goes out at a 90-degree angle from your body. So you just have to be a little careful insertion wise. Outside of that, your feelings of orgasm are exactly the same. Even if you have your prostate removed, you still feel like you are ejaculating. You still have that pumping feeling that you get when you do ejaculate. The other thing people ask me is, well, what about MRIs and CT scans and PET scans? Doesn't affect any of that at all. What about, how does it affect urination or any bladder issues? And the answer, it doesn't affect it at all. As a matter of fact, I tell you real quickly, if you have a problem with your bladder and they need you to do a cystoscopy, I went to a urologist and they put a little camera up your penis, and I said, "Wait a second." I pumped up like a quarter of the way, and he stuck the camera in. It was totally not painful, and he looked at me, and he said, "Man, I wish all my patients were like this." It was crazy, but it was very, very easy to do. I would suggest, again, anybody who is thinking of it, who is having an issue with their manhood, um, you can use the implant. You don't have to worry about, time sequences. If it's up 4 hours, you don't have to run to the hospital. You can leave it up 4 minutes, 4 hours, or 40 days. It's not going to hurt you. You become the Energizer Bunny, if you like. You can keep going and going and going. So all in all, I will say I've been married 55 years. I've been with my lady 62 years. And this is the second best thing I ever did in my life, was get the IPP, the implant.